So now that we've established that airborne transmission is important and we have targets, the next question is, how do we achieve those targets? And our Lancet task force released another report a couple of months ago. We call the first 4 healthy building strategies every building should pursue to reduce risk. I'm going to walk through these 4 steps very, very quickly, and hopefully it makes a lot of sense. Number 1, what's called commissioning your building systems, or I like to talk about it as giving your building a tune-up, much like you do for your car. Everybody knows car performance changes over time if you're a car owner. And you have to go in for a tune-up, oil change, wiper fluid, rotate the tires, basic things. Same thing happens with buildings. Over time, their performance slips. So not only do we have bare minimum ventilation targets right now, they're design standards, but performance slips over time. And one of the most important things you can do is bring the building back up to the way it was designed. This has multiple benefits. It improves indoor air quality, also saves energy, it'll save you money. So it's a good climate mitigation tool. Improves indoor air quality, helps against COVID and other respiratory infections, and actually it's going to save you money. Lawrence Berkeley National Lab estimates it's just a few years return on investment for investing in commissioning or tuning up your building systems. Number 2, maximize the outdoor air. When these respiratory particles are emitted, they accumulate inside and in our indoor spaces. We have a few means by which to remove them or clean them out of the air. If we bring in more outdoor air, we dilute these any airborne infectious particles. When you do this, is also multiple benefits. We see improvements in terms of reduced sick days. We see better cognitive function, fewer missed work days for workers, fewer missed sick days for kids. So there's a lot of benefits to higher ventilation rates. In tandem, can also upgrade your filtration in your mechanical system. The standard filter used in most buildings, called a MERV 8 filter, captures a very small % of airborne particles. A MERV 13 captures upwards of 80–90% of airborne particles. MERV 8 filters are designed to protect equipment, and MERV 13 filters are designed to protect people. The new minimum should be MERV 13 filters. 4th, you can supplement this with use of portable air cleaners. These are relatively inexpensive. And if you have a system that can't bring in more outdoor air, you can upgrade the MERV 13 filters. These are, and this is an approach with a deep scientific evidence base. You can have a portable air cleaner with a good HEPA filter. We'll talk about details about what to look for and how to size this appropriately, but it's essentially plug and play technology. If it's sized right for the room, and it has a high performance or a high clean air delivery rate, it's going to provide upwards of 4, 5, or 6 air changes an hour by itself, even without thinking about your mechanical system. There's a lot more we can do. The task force agreed if we just did those 4 even, it would go a long way to improving the health of people indoors.
The healthy building strategy is extremely important. And these strategies remove the variability of individual health statuses and behaviors. And the strategies are designed to remove infectious particles from the air altogether, and they are not subject to the waning effects, but they are enduring. And so this is a structural solution that's extremely viable, and you could compare it to providing clean water for everyone to drink. In the same way we want clean water, we want clean air for everyone to breathe who is living in a long-term care facility, visiting one, or working there.
Well, number 1 is take a look and see if you can improve and increase your ventilation. That could mean a very expensive retrofit of your fans, but it could also be reasonably done with some exhaust ventilation. If it's difficult to do ventilation, I think that's the first place to look. I would look then at, could you use filtration? Could you use air cleaning through portable air cleaners in your patient rooms? And these need to be sized carefully to make sure you're providing the right size of an air cleaner. If you don't have the right size of an air cleaner, it's not going to help. So you must pay attention to the size of the air cleaner that or multiple air cleaners that you're using in a space. I'd also like to draw attention to something that wasn't discussed, and that is the pressure differential in the facility. it's really important to consider whether your pressure differential is going to be negative pressure or positive pressure in your patient spaces. And the reason is because if your space is negative, so if you have a hospital room and it's negative with respect to the hallway, then any airborne particles or aerosol will be contained in the patient room and will not come out into the corridor and move around the facility. So I'd like to highlight again opportunities to increase your ventilation, add air cleaning, and then really take a look at your pressure, your pressure distribution in your facilities as a third defense for trying to protect your residents.